Welcome to today's Medicare 360 show. I'm your host, Jennifer Lee. Let's get to it and go over the Medicare New Handbook. We did end at page 39 last week, so let's get to it, covering drugs. So Part B covers a limited number of outpatient prescription drugs like most injectable and infused drugs when a licensed medical provider gives them. Certain oral anti-cancer drugs, drugs used with some type of durable medical equipment like a nebulizer or external infusion pump, intravenous immune globulin for use in the home, FDA-approved pre-exposure prophylaxis PrEP medication for HIV prevention, certain drugs you get in a hospital outpatient setting under very limited circumstances. Most renal dialysis drugs and biological products over at page 44. Note, other than the examples of above, you do pay 100% of most drugs unless you have Medicare drug coverage Part D or other coverage. Go to page 79 and 90 for more information about Medicare drug coverage. I just had a recent client that had started using her drug plan, and she did have to pay a deductible because the deductible for Part D drugs is at $590 for 2025. She understands that Medicare caps the drugs at $2,000 if it's covered. So she's asking, why does she need a drug plan if Medicare caps it to $2,000? So while Medicare does cap that, you do have to get a drug plan to avoid the 1% penalty for every single month you don't have it. So keep in mind that although when you look at your Part A and Part B Medicare card, there's nothing on there that says you need a Part D, but definitely you do have to get a Part D to avoid that 1% penalty for every single month that you don't have one. Okay, let's continue. For some drugs used with an external infusion pump and for intravenous immune globulin for use in home, Medicare may also cover services like nursing visits under the home infusion therapy benefit and the intravenous immune globulin benefit, page 44. Part B also covers some injectable or implantable drugs to treat substance use disorder when a provider administers them in a doctor's office or in an outpatient hospital setting. You pay 20% of the Medicare approved amount for these drugs. The Part B deductible applies. You won't have to pay any co-payments for these services if you get them from a Medicare enrolled opioid treatment program, page 47. Doctors and pharmacists must accept assignment for Part B covered drugs, so you should never be asked to pay more than the co-insurance or co-payment for Part B drug itself. Okay, important. Your co-insurance can change depending on your prescription drug prices. You might pay a lower insurance for certain co-insurance for certain Part B covered drugs and biologicals when you get them in a doctor's office or pharmacy or in a hospital outpatient setting, if their prices have increased higher than the rate of inflation. The specific drugs and potential savings change every quarter. If the Part B covered drugs you get in a hospital outpatient setting are part of your outpatient services, you pay a co-payment for the services. Part B doesn't cover self-administered drugs in a hospital outpatient setting. Self-administered drugs are drugs you normally take on your own. What you pay for self-administered drugs in a hospital outpatient setting depends on whether you have a Medicare drug coverage Part D or other drug coverage. If the hospital's pharmacy is in your drugs plan's network, if you have other drug coverages, your drug plan may cover drugs that Part B may not cover. Contact your drug plan to find out what you pay when Part B doesn't cover the drugs you get in a hospital outpatient setting. So just key things to know. Part B, which is the medical, could cover some of your drugs if it's ordered at the doctor's office, the hospital. So that's Part B, could be your chemotherapy, your outpatient setting, and so forth. So that is included in Part B medical. Part D, as in David, those are your drugs that your doctor prescribes you and you get it refilled at your pharmacy. There are preferred pharmacies, there are non-preferred pharmacies. Some pharmacies that are non-preferred, you'll pay higher prices. Some plans, it doesn't matter. And then there's also plans for a 90, 100-day supply. They will lower the cost for you, or if you do mail order, they may be able to lower the cost for you on that as well. So keep that in mind. Part D is the drug plan portion, and Part B is something that your doctor prescribes and facilitates and gives you at the doctor's office or the hospital. Keep in mind also, if you have a Medicare supplement or a Medigap plan, you do have to get a separate Part D drug plan coverage, and you should always check your plan every single year for changes on the formulary, the pricing, and so forth. Then the Part D, if it is in a Medicare Advantage plan, you have the A hospital, B medical, and D drugs to equal Part C. Most Part C, which is Medicare Advantage, does come with the drug plan embedded in it. However, there are some plans that don't have the Part D drug plan, so keep that in mind when choosing a Medicare Advantage plan for that option to make sure if you do need a drug plan, you definitely make sure you have that. Who wouldn't need a drug plan? Let's just say someone that has veterans coverage, TRICARE, that they already have a credible drug plan in place. They don't need to necessarily get a drug plan on your Medicare Advantage plan. Hope I didn't confuse you, but there are nuances and so forth. So that's why please contact us and we will help you with that. Okay, let's move on to durable medical equipment. Okay. Medicare covers medically necessary items like oxygen and oxygen equipment, walkers, and hospital beds when a Medicare enrolled doctor or healthcare provider orders them for use in the home. You must rent most items, but you could also buy them. Some items become your property after you made a number of rental payments. You pay 20% of the Medicare approved amount, then Part B deductible applies. So these are like your walkers, your canes, your wheelchairs. People often ask, like, are the scooters or the wheelchairs that are electronic or the ones that run in a motor, are they covered? Most of the time they are not for those type of wheelchairs. Think way back, there's a lot of fraud on those, so I tend to find that it's not covered, but hey, we could definitely try to get that order from you from your doctor if really need be. CPAP machines have been pretty popular nowadays, as well as like foot inserts if you're diabetic and so forth. So keep that in mind. So make sure your doctors and DME suppliers are enrolled in Medicare. It's important to ask your suppliers if they participate in Medicare before you get DME. If suppliers are participating suppliers, they must accept assignment, which means they can charge you only the coinsurance and Part B deductible for the Medicare approved amount. If DME suppliers aren't participating and don't accept assignment, you may have to pay for the full cost of the DME. So if that's the case, usually if you are on a Medigap plan, it could be covered, right? And then your Medicare Advantage plans, sometimes it is the 20%. Sometimes if it's a certain amount, like $100 or less, You don't have to pay for that. Over 100. Those are just some examples. Other examples, if you are on Medicaid or Medi-Cal, the rest should be covered by Medicaid and Medi-Cal in California. So keep that in mind as well. Sometimes when your doctor does refer out and orders it for you, you do need some follow-up on that. And that's some service we do to make sure that the vendor has the order and you could get that in a timely manner. Okay, let's go to page 41. Electrocardiogram, EKG or ECG screenings. Medicare covers a routine ECG screening if you get a referral from your doctor or other healthcare provider during your one-time Welcome to Medicare visit, page 54. After you meet the Part B deductible, you pay 20% of the Medicare approved amount. Medicare also covers EKGs or ECKGs as diagnostic tests, page 51. We also pay a co-payment if you have a test at a hospital or a hospital-owned clinic. Okay. Emergency department services, Medicare covers these services when you have an injury, a sudden illness, or an illness that quickly gets much worse. You get a co-payment for each emergency department visit and 20% of the Medicare approved amount for your doctor visits. The Part B deductible applies. If your doctor admits you at the same hospital as an inpatient, your costs may be different. So sometimes on these Medicare Advantage plans, when you go to the emergency room, you do have to pay a copay. Then they usually say if you're admitted to the hospital, let's just say within 24 to 48 hours, you could get reimbursement for that or not pay for that copay. But keep in mind, sometimes when the hospital's really busy and you do stay overnight, but not admitted, there is that emergency room charge still, and it won't be waived. So, but clients have questions on that. Okay, e-visits. Medicare covers e-visits to allow you to talk with your provider using an online patient portal without going to the provider's office. Providers who could give these services include doctors, nurse practitioners, clinical nurse specialists, physician assistants, physical therapists, occupational therapists, speech language pathologists, and when they are for mental health care, licensed clinical social workers, clinical psychologists, marriage and family therapists, and mental health counselors. To get an e-visit, you must request one with your doctor or other provider. You pay 20% of the Medicare approved amount for your doctor's or other provider services. The Part B deductible applies. Keep in mind, sometimes for Medicare Advantage plans, the groups, the insurance company, and the doctor, I've been hearing some doctors aren't able to claim or bill for an e-visit or like a telehealth visit. So definitely talk to your provider, your doctor, to make sure. Okay, eyeglasses. Eyeglasses. Medicare covers one pair of eyeglasses with standard frames or one set of contact lenses after each cataract surgery that implants an intraocular lens. Medicare will only pay for contact lenses or eyeglasses from a supplier enrolled in Medicare, whether you or your provider submits the claim. After you meet the Part B deductible, you pay 20% of the Medicare approved amount for corrective lenses after cataract surgery when intraocular lens. So keep in mind, if you're on original Medicare, a Medigap, or it's called a Medicare supplement, eyeglasses aren't covered unless you do this cataract surgery. So just like getting the exam and getting your eyeglasses is not covered by original Medicare. However, if you are on a Medicare Advantage plans, I would say most of them do have an eye exam and frame contact lenses coverage on there. Of course, each plan has different figures or different coverages for that. Okay, so federally qualified health care health center services. Federally qualified health centers provide many outpatient primary care and preventive health services. There's no deductible, and you usually pay 20% of the charges or the Medicare approved amount. You pay nothing for most preventive services. Federally qualified health centers may offer discounts if your income is limited. Visit findahealth.hrsa.gov to find a health center near you. Preventive service, slow flu shots. Medicare covers a seasonal flu shot or vaccine. You pay nothing for the flu shot if your doctor or healthcare provider accepts assignment for giving you the shot. So just make sure if you do go to your local pharmacy that offers this, see if they cover it based on your plan. Foot care. Medicare covers yearly foot exams or treatment if you have diabetes-related lower leg nerve damage that can increase the risk of limb loss, or if you have medically necessary treatment for foot injuries or diseases like hammer toe, bunion deformities, and heel spurs. You pay 20% of Medicare approved amount for medically necessary treatment your doctor approves. The Part B deductible applies. You also pay copayment for medically necessary treatment in a hospital outpatient setting. So this usually, you see a podiatrist for this as well. Okay, we're on page 42 now. So let's talk about preventive service of glaucoma screenings. Medicare covers the screening once every 12 months if you're at high risk for the eye disease glaucoma, sorry, not eyeglass. You're at high risk if you have diabetes, a family history of glaucoma, are African American and 50 and older, or are Hispanic and 65 or older. Now, a doctor who legally allowed to do glaucoma screenings in your state must do or supervise the screening. You pay 20% of Medicare approved amount. The Part B deductible applies. You also pay copayment in a hospital outpatient setting. Hearing and balance exams. Medicare covers these diagnostic exams if your doctor or healthcare provider orders them to see if you need medical treatment. You could visit an audiologist once every 12 months without an order from a doctor or other healthcare provider, but only for non-acute hearing conditions like hearing loss that occurs over many years. And for diagnostic services related to hearing loss that's treated with surgically implanted hearing devices. You pay 20% of the Medicare approved amount. The Part B deductible applies. You also pay copayment in a hospital outpatient setting. Medicare doesn't cover hearing aids or exams for fitting hearing aids. So unfortunately, I don't know why in any healthcare insurance, these exams and hearing aids aren't covered. To think about it, it's not something cosmetic. People with hearing loss actually do really need it. My husband, my son has hearing loss, and even myself, I just found out that I have loss of hearing in my left ear, which is a shocker to me because I never had that issue before. But nowadays, when people are whispering in my ear or at party settings or social gatherings, it's like I have to ask, come again? What did you say, right? So definitely do check your ears out. Especially if you're kind of like, hey, I can't hear, right? Go to a good provider for that. Another thing to know, Medicare Advantage plans do have the hearing exam and hearing aids covered. Some plans are better than others. Some give you up to a certain amount of coverage. Some could do reimbursement, or some you do have to pay a copay, either for a standard pair of hearing aids or like a premium one, right? So you have to pay more. Preventive services. Let's go to hepatitis B shots. Medicare covers these shots or vaccines if you meet at least one of these conditions. You've never gotten a complete series of hepatitis B shots, you don't know your vaccination history, or you're at medium at high risk for hepatitis B. Some risk factors include hemophilia, end-stage renal disease, ESRD, diabetes, living with someone who has hepatitis B, or employment as a healthcare worker who has frequent contact with blood or bloody body fluids. Check your doctor to find out if you're at medium or high risk for hepatitis B. You pay nothing for the shot if your doctor or other healthcare provider accepts assignments for giving you the shots. Okay. So, hepatitis B virus infection screenings. Medicare covers hepatitis B virus infection screening test if your doctor orders it. Medicare also covers a screening test yearly only if you have a continued high risk and don't get a hepatitis B shot. If you're pregnant, at the first prenatal visit for each pregnancy, time of delivery for those with new or continued risk factors, first prenatal visit for future pregnancies, even if you previously got the hepatitis B shot or had negative hepatitis B screening results. You pay nothing for the screening test. The doctor or healthcare provider accepts assignment. Preventive service hepatitis C virus infection screenings. Medicare covers one hepatitis oh my gosh. Let's do this over. Medicare covers one hepatitis C screening test if you meet one of these conditions. You're at high risk because you have or use illicit injection drugs. You have a blood transfusion before 1992. You're born between 1945 to 1965. Medicare also covers yearly repeat screening tests if you're at high risk. Medicare will only cover a hepatitis C screening test if your healthcare provider orders one. You pay nothing for the screening test if your primary care doctor or other qualified healthcare provider accepts assignment. Preventive service, HIV human immunodeficiency virus screenings. Medicare covers HIV screening tests once per year if you're between 15 and 65. You're younger than 15 or older than 65 and at an increased risk. Medicare also covers this screening test up to 3 times during a pregnancy. You pay nothing for HIV screening tests if your doctor or other qualified health care provider accepts assignment. Medicare now covers more screening and services if you are at increased risk for HIV. Go to page 48. On a side note, there are definitely programs from the Department of Health Services. Check your state, county, as I have clients that basically get their Medicare, their supplemental, their drug prescription paid if they do have HIV. So keep that in mind and contact me for more details on that, on how you could participate in that program if you do have HIV. Home health services. Okay. Home health is a good topic. I think we will leave it for next week, just so it is a lot to cover. As always, please contact us at any time. Follow us at Medicare 360 Show on Instagram. I'm your host, Jennifer Lee. Till next time, you have a wonderful day. Take care.